even if you're being here early, just go ahead and just ask them. There's no restrictions to the kind of questions that they'll answer for you. We'll try and get those answered. So Dr. De Alba, thank you for being on the front line of this pandemic, and for your commitment to your patients and the volunteers and staff at the American Heart Association. So we're several weeks into the COVID-19 pandemic. How do you think we're doing as a region right now?
Well, first of all, thank you very much for the invitation, for the kind introduction to the American Heart Association. Thank you for the invitation for being here with the community and have this conversation, important conversation with our Latino communities, not only locally, but also globally. In terms of your question, I want to start with honoring as well my colleagues, doctors, nurses, technicians, people who are, risking their lives, public health officials who are assuring who we work as society as well. And it is a team effort for sure. So compared to other states like New York or Washington state, Nebraska is in a better position at this point, but things can change. One factor where I'm saying that we're in a better position can be because of the geographic location. Places like New York, like Washington state, they receive more people than us. But eventually we are also receiving people who are infected from other states and even nations. So another big factor is that we house the biocontainment unit. It's the largest biocontainment unit in the nation here in Nebraska. So we have it at UNMC. Also, we have the Nebraska the quarantine unit. And these units have groups of health experts who have been trained for over 10 years. They know how to react, how to collaborate, how to implement protocols to respond in an emergency like this one that we're facing with coronavirus. But the work is not alone. We also collaborate with other agencies, public health departments, locally, nationally. We also work with organizations, community organizations. So we operate in a very coordinated way for this response.
And yeah, I mean, Dr. De Alba, UNMC is also, setting the trend and kind of, in a way, being the guinea pig and setting the example for a lot of the hospitals should be doing across the country when dealing with this. Now, something that a lot of people may not realize is that there is kind of a substantial, large Hispanic and Latino population in Nebraska, and even in Iowa, just because there are a lot of food processing plants, which attracts a lot of people to come into these areas to take these jobs. So why should the Latino and the Hispanic community be concerned right now when it comes to COVID-19?
Well, thank you very much. That's a very good question. First of all, I would like to say that we all should take this COVID-19 challenge seriously. This is not only about one race, about one nationality. It is not about one ideal or a political, ideal or for a party. This is about the healthcare for everybody here, not only in Omaha, not only in the nation, but also around the world. But certainly we have identified certain vulnerable populations. In the beginning, we identified that people 60 years and older, they had a higher risk for obtaining this disease. But also now we're identifying that some populations have also certain factors that are in risk for COVID-19. And the Latino Hispanic community have a lot of these risk factors, such as hypertension, diabetes, cancer. Those are the top leading causes of death for Latinos in the United States. We need to pay attention to that. And also we'll have other factors that make us vulnerable, like obesity, like smoking. So this is why we need to keep in mind that we are also vulnerable against COVID-19.
So what is the most important, you kind of mentioned there's, other Latinos in general tend to have a lot of underlying health conditions in their history. So what's one of the most important things that the Latino and Hispanic community should know about the COVID-19 pandemic? And what are you seeing? You're again on the front lines at UNMC and in your health system. What are you seeing?
Well, definitely I wanna say there are many important things to share with the community, but one key message is that the coronavirus, this new coronavirus, which is the SARS-CoV-2 that causes COVID-19, it's already in our community. It's not that it's in another place, in another country, it's already here. It's already in the places where we play, where we go to work, where we interact as society. It is in our neighborhoods. So it is right here with us. So this is why it is important that we follow the recommendations, the preventive recommendations, such as staying home and staying informed. So we all need to follow these recommendations for sure because of this reason.
And I think by now we should all know them, but can you go a little bit more into like what someone can be doing to protect themselves, their family, and their community during this time?
Absolutely. Well, in general, we have two kind of recommendations. We call it individual recommendations and social measurements. So recommendations at the individual level and at the social level. Both are equally important. At the individual level, so what we can do is washing our hands continuously for 20 seconds with soap and water. If we don't have that, we can use those alcohol gel where we can clean our hands and doing it until the alcohol is evaporated. Also, when we cough and sneeze, we need to cover our mouth either with a Kleenex or elbow, the internal area of our elbow, to avoid that the saliva goes and spreads out and infects other people. And also we need to clean the surfaces where we work, where we are close. So those are the things that we can do at the individual level. But also we need to do preventive measures at the social level, like social or physical distancing, where this is a very important, we need to clarify this key term, because it's not that we want to avoid the social interaction, because what we are doing right now, we're socializing, right, via virtually. What we want to avoid is, what we want to do is physical distancing. So we are recommending we're recommending to stay at home and not to go to public places. We are also strongly recommending not to go to get together with friends or other houses. We need to stay at home, because that's definitely a way how we can reduce the numbers of dissemination and avoid contagion other people as well. So again, individual measures and social measures are very, very important to protect ourselves and others who are around us.
Sure. And, we kind of see it from doctors here locally and nationally. I mean, like you said, this is a brand new virus. And so the symptoms can be, a lot of people can be asymptomatic, like they don't even know that what the symptoms are, or it takes a few days to get them. So what are some, it's going to be kind of a follow-up question, but what are some of the symptoms that you're seeing, again, from you being in the front line, as far as the most mild to, obviously we hear the chest pain and the coughing, but then what should people be doing once they get one or any of those symptoms?
Absolutely, that's a great question. And this message has to be consistent with what we read, with what we hear from other sources. So we know, based on previous studies, that there are certain symptoms that are characteristics of the COVID-19, but also there are symptoms that are very similar to a flu-like disease. But let me start with what are those characteristic symptoms that we identify with COVID-19. We know that it's fever, and what I mean about fever is a temperature higher than 38 Celsius, or a temperature of 100.4 Fahrenheit. So that's what we call fever, or having cough, or having difficult shortness of breath, that you cannot breathe, and you have a hard time breathing when you're walking or going upstairs. And others can be like having some, like we call in Spanish, cuerpo cortado, or like when you are gonna have a cold symptom. But these have to also be complemented with something that we call epidemiological data or factors. And that means that if you know that you were close to a person who was diagnosed with COVID-19, in the past, it was if you traveled to a country where there were COVID patients or with high numbers of COVID patients, that was a factor. But now the new coronavirus is in our community. So the epidemiological factor is that if you are in close contact with someone who was diagnosed with COVID-19, or you knew that you were in the same area, like for instance, in a grocery store where the local health department tells you, you know, at this time, this person, or there was a person who was diagnosed with COVID-19 and it was at this time in the grocery store. So those are the kind of like the messages that you have to pay attention, because that will complement those symptoms that I have just described, to suspect that you might have the COVID-19. Now, this is, so what to do when you think, if you think that you have COVID-19, well, the first message that I want to say is that don't go right away to the clinics or the hospital. Call first. So that is the strategic step that we're doing here, is that you call first your doctor, if you have a doctor, or if you have a clinic or a service that you use or you regularly use for your healthcare. Call them first, because there are protocols that we have established and we have in place where you can actually be directed and be safe and protect your health, but also the health of the people who might be in the hospitals. So that is the first step. Now, what happens if you have a condition where you cannot handle it, where you feel that you are in an urgent situation? Call 911. So 911 is also prepared and trained to receive people who might be infected with COVID-19. Just tell them in advance that you suspect that you have COVID-19 or you've been diagnosed with COVID-19, and they know they have protocols that they can follow in order to take care of your health and transport you to the right service. So again, the message here is call first the service in order to activate the protocols. And so we are ready to transport you or receive you in the healthcare services where you need to be taken care of.
So obviously a big worry is, getting it, but also, for example, I'll use myself as an example. I'm still working. So I still come into my news station, even though we've done a lot of social distancing practices and 95% of our staff is working remotely. I still go to the store. And just because I'm working, I'm also worried about, if I were to get it, passing it to someone else, right? So what are some preventative measures that we can take to make sure that we're not passing it? For example, I take my temperature multiple times a day. There's a face mask. What else can we be doing to make sure that we ourselves are not, passing it along and protecting ourselves from giving it to others if we may not know we have it?
That is definitely, and I'm gonna answer that question. But before I forget, some key points that I also needed to mention in my previous question was that the local health departments, they also have lines where they can provide information and guide you about what to do or steps to follow in order, if you want to seek for medical attention, or if you don't have a clinic or a hospital, they are able to provide you a reference or guide you where to go. And also the local health departments have had agreements. For instance, I know with the Mexican consulate in Nebraska that they have agreed that they will protect the information, each information from each person, so they are not used against their legal status or their process. So there is that resource for our community as well. I just wanted to mention that because it's important, because some members in our communities might not have clinics or hospitals, but they have resources available, and it is important that they know about this and they use them because it's tailored for them as well. They have services in Spanish. Now, answering your question, Maya, it's important that even if you have to do, there are some jobs that require that you have to be out there. We need to keep functioning as society, of course, and we need to take preventive measures. So, like you just said, you're doing great in checking your temperature at least once a day. That's good. Other things, now we know based on CDC recommendations and that you have to wear masks. So it is recommended now that you wear masks when you are outside, not only to protect yourself, but also to protect others. And the other recommendations is still being, and it's clearly the message of washing the hands. So washing the hands every time that you are grabbing like a door, when you open a door, after you open a door, or if you are in the public areas, right after you wash your hands, or bring your alcohol, your hand sanitizer with you, etc. So also, if you're gonna call other things that you have to do, Maya, it's to pay attention to your sleep. You have to, there are also things that you can do for your physical health to have an optimum immune system, or to have your immune system optimum to fight a disease such as the COVID-19. Like, for instance, having a healthy diet. Now it is the time to start a healthy diet if you're not following it. Having vegetables, fruits in your daily basis, in your meals. Stay hydrated. It's very key. Stay hydrated. Also, the other things that you can do, like for instance, you can do exercise in your house. Try to decrease your amount of alcohol, because the alcohol suppresses the immune system, and you want the immune system to be optimum. So I'm not saying that that you cannot have a glass of wine or something like that. I'm just saying that avoid excessive amounts of alcohol at home. Also, if you are a smoker, believe me, this is the right time to stop smoking, because when you smoke, that goes straight to your lungs, and this virus likes to affect your lungs. So if you are thinking, or if you've been thinking about the stop smoking, this is the right time, because that is something that can definitely be a game changer for having or not having COVID-19. And also mentally, talking about mental health, that's very, very important. Trying to stay connected virtually with your friends or your family, trying to, checking others, how are they doing? Also doing mindfulness, meditation, that helps. If some people like to do yoga, or some people like to maybe exercise or do Zumba at home, those are things that you can do to protect your health as well.
Oh, sorry, I have to unmute. I think I'm good. Can you hear me, Dr. Alba? Can I get a thumbs up? Okay, perfect. So just to confirm, we are, we were kind of talking, there were some technical issues that I had to, I just want to make sure, did you address the use of gloves? I know you mentioned masks and things, but also just even how we take it on. I know people have kind of talked about making sure we harm the ears. So quickly, just to kind of respect time again, what masks should they be worn and where, and then gloves?
Well, that is a good question. We have to be careful here too about using sophisticated or specialized gloves or masks, because definitely we need those for the patients and people who go to the hospitals, and also for our healthcare providers. It is a challenge that we're facing not only in the United States, but around the world. We're running out of protective equipment, especially for those who have to take care of others. So respirators with N95 and gloves that we use for surgical procedures, those have to be actually in the clinics and the hospital for those who are taking care of people, or for people who are very vulnerable or very sick, that they need to be protected, but not for the regular, for the general population. Not to go to the grocery store is not needed at this point. The recommendations are not directing us towards that yet, for what we know at this point. What you can use the mask, like for instance, those cloth masks, face masks that you can use. If you have there are specific materials, but that you can regularly find in the pharmacy that are not for surgical procedures, you can wear them as well, but definitely they have sophisticated materials or respirators or gloves. Please make sure that those actually, if you have the opportunity to share them with someone who is a provider, healthcare provider, please do it, because they will need it more than us or people who are in general areas or public areas, for sure.
So you kind of mentioned people with higher risk, so which kind of leads me to my next question. We know that those who are in high risk categories like heart disease and stroke survivors, and those that are over the age of 65, what should those individuals know about COVID-19 and their potential risk for the virus?
I had a problem in the audio. Could you repeat the question real quick, Maya? Sorry.
So for people who are at high risk, for COVID-19, people who have heart disease or are stroke survivors and over the age of 65, what should these individuals know about COVID-19 and their potential risk?
Absolutely. Well, first of all, they have to follow the same recommendations the community. So it is important they control or they manage their health. If they have an underlying condition, they have to make sure that that is controlled at this point. They should definitely be in touch with their healthcare providers, with their clinics, keep up with their appointments. Don't cancel medical appointments because you might think that they are not doing a protocol or guideline to protect you. If you have to go to the clinic, don't do that. Actually, we have protocols, guidelines to do and to apply with the community, with our patients that they need regular services or attention. So you are not combined with the patients that are coming for COVID-19 purposes. So you have to really take your regular treatments. You have to keep up with your appointments. There are now strategies that we use like telemedicine, where even your doctor can see you through the camera, they can see you remotely, and not necessarily, you have to go over there. Now, if you have a condition that you have to go because of your doctor considers that it's important to listen or check you in person, definitely I would recommend to do that, and don't be afraid to go to the hospitals and clinics. Again, we have protocols to protect your health.
Dr. Alba, what about people who have hypertension? Do these people have a higher risk of getting COVID?
Yes, I mentioned it earlier in one of the responses. So one of the challenges that we face in the healthcare system in general around the world is that this COVID was let me take 1 minute to clarify something that probably the community will appreciate this comment too, that what is COVID-19? So COVID-19 stands for coronavirus 2019. So coronavirus is not a new virus. What is new, it's actually a new member of the family coronavirus. And that new member, it's called SARS-CoV-2 that causes the disease of COVID-19. So COVID-19 is the disease of the new coronavirus. So basically, again, so if we are learning now things like underlying conditions or other diseases or other factors that are like give a higher risk to the community to suffer COVID-19, and hypertension is one of the most common factors that we are seeing now as an evidence in other patients, that it's definitely a component that can open the door to the COVID-19 and affect the population. So hypertension, it's one of the main factors that we're seeing nowadays, not only in elderly, but also in young populations.
Sure. And you touched briefly a little bit earlier about how emergency services and hospitals are treating people who are higher risk and are possibly needing to be tested or treated for COVID-19. Can you share what emergency rooms are doing to be available for these types of emergencies and how they're kind of protecting non-COVID patients as well?
Thank you, Maya. That's important. I think it's good to reinforce this message to the community. Like each hospital and clinic have their protocols, but at this point, there is a so we are synchronized in terms of we have in place. Let me talk from what UNMC is doing. Like for instance, we have in place a protocol where when someone calls us, that they tell us that they suspect that they have COVID-19 or that they know that they have COVID-19 and they need medical attention, we automatically activate a path where we take them. We don't combine the COVID-19 patients with the patients who come for other services. So that's a way how we are protecting our community in general, but also our healthcare providers. This is something that is being consistent with other healthcare facilities, not only in the state, but also in the nation.
All right, well, thank you so much, Dr. Alba. Is there anything else that you would like to address or that you think is important for people to know at this time?
Absolutely. Well, I think it's an opportunity for us to see this challenge as a time where we all need to be together. So it is a time also where it represents a challenge for us from the healthcare services, where we need to advocate for communicating with our communities in more than one language, for also reaching out that are in rural areas, for reaching out to communities who are minority communities who don't have the access to healthcare services. So there is responsibility from our end to actually bring everybody on board. But also as a community member, it is in our hands that we also help to avoid the spread of the disease by following the recommendations, individuals and the social preventive measures. We can do something. We can be also in the front lines by following this. And again, this is a battle that we all need to wage together, and it starts with ourselves, in our homes, in our communities. Thank you.
You know, and I'm just going to jump in here again and ask you one last question, because it's, you know, you offered your time to speak with us, and so it's we don't always get access to you. So I want to make sure I ask you, how are you doing? I mean, again, you're in the front lines, you're working at UNMC, which is such a big hub for, even at the beginning, first cases in the US of COVID-19 and bringing people in here. So what's it been like for you, and as far as how this has kind of changed your career and what you're seeing, you know, as being working in the medical field right now?
You know, just to share a little bit of the my personal story. Since I was a kid, I wanted to be a doctor, and because I wanted to help people not only when they were sick, but also I wanted to protect people before they were getting sick. That's why I continue with, along with my medical studies, I wanted to do a public health master's. And so this challenge of the COVID-19, it's a very good testimony and a good reminder why I wanted to join medicine and public health. So this is an area where it is very clear the importance of public health into the healthcare challenges that we live today, because what we're facing right now is a public health challenge. We need to actually, in order to combat this virus at this point, we need to look at the preventive measures. We need to coordinate efforts at the community level. And we're here, physicians, working as a team with other public health agencies. We're seeing the beauty of what healthcare is about. It's been a team effort. So it's been very, very rewarding, but also it's been a time of reflection for me, how much I also value my family, my friends, and being together with others, you know, and it's that component, it's also very, very important. But this is everything transformed with the passion that I feel for being a doctor and a public health provider and a researcher. So thank you for asking that. And I hope some community members, especially young generations, also get this message, because we need them in order to provide quality care, and we need them in the front lines in the future. So don't hesitate to follow healthcare careers, because we need you. Please pass that message.
Awesome. Well, thank you again so much, Dr. De Alba. You know, UNMC is such an incredible asset to our community, and as you are, I mean, I feel lucky to call you a friend. I know you're very passionate and are doing a lot of work, so thank you.
Thank you. Bye.
Well, I'd now like to turn to Viridiana Almanza, who's the Director of Family and Community Wellbeing for the Latino Center of the Midlands. So thank you so much for joining us, Viridiana. Now, the Latino Center of the Midlands is such an incredible resource for the community year-round, regardless of what's going on. What role is the center playing right now during the COVID-19 situation that we have?
Thank you, Maya. And yes, the Latino Center has been around for almost 50 years here in Omaha, Nebraska. So we have a history of supporting our community, especially those that are seeking culturally competent information or support, bilingual support in Spanish. The Latino Center is continuing to offer their programming through our 3 different departments: Workforce Education and Innovation, Pathways to Success, and Family and Community Wellbeing. Aside from that, we have had to significantly increase our community support. We are a lot of the times the voice for many of our community members that are Latinos, that are recent immigrants to our community, and that only speak Spanish or a different dialect other than Spanish. So we have had to increase our awareness of the resources in our community, because people call us asking, where can I find information for unemployment? Where can I find pantry referrals? What should I do now with COVID-19? So we are having to increase our community support. We are connectors, and we love that, because anybody can feel comfortable calling our phone, and we will, if we can't help them, we will refer them out. And something else that is very important, we are taking the role of providing awareness to our community. We take it very serious. We take the situation very serious. And like Dr. De Alba mentioned, we need to provide information for our community awareness, especially when it comes to social distancing, the importance of staying away or staying at home if at all possible, or, you know, we understand that a lot of our community still needs to work. Stay at home when you can. Stay at home when it's unnecessary to be out there. And then also we provide awareness and campaign via our social media in terms of, you know, washing your hands, using gloves, not touching your face, and then also wearing masks. For some of us, it might be embarrassing to wear a mask, but there's a saying in Spanish, más vale prevenir que lamentar. So that's basically saying, you know, better be preventive and not let anything happen. So that's the role we're playing. Still continuing to provide our programming, still providing services to our community, and then raising awareness amidst this COVID-19 situation.
And, you know, as you said, you're getting lots of different calls of how you can, the resources that you can be offering. What are some of the biggest calls that, or the, you know, the spike in calls that you're getting about related to COVID-19?
There's a couple of areas of concern within our Latino population, but many of our calls revolve around, you know, what is COVID-19? What can I do? What if something happens with my family? It seems like there's a lot of worry about getting COVID-19 and the healthcare process that would entail. Who do I call? Where do I go? Who's going to pay for it? And a lot of information. We are thankful to the nonprofits and other public agencies that they offer at minimum Spanish and English translations of these important newses. But then others are just in English. So it's up to us, up to you. You know, you also offer section in the news in Spanish to provide this awareness to our community. So health is their primary concern. Second, unemployment. What do I do now? What if I lose my job? Do I qualify for unemployment? Those are some of the calls that we have been getting, and we have such a strong partnership with Heartland Workforce Solution that we know how to assist them or where to refer them directly to get those questions answered. And then the second, food insecurity. That's a big one for our community. If we lose our jobs, you know, if somebody has COVID in our family, how do we get access to the pantries? How do we get access to foods, to the necessary items that we need to continue with our lives?
You know, and I'm sure those are very valid and important questions that I'm sure a lot of people are having. Just to reiterate, who can call, who are you guys helping, in what ways can people reach you if they need any type of service or a resource from you guys?
That's a great question. At the Latino Center of the Midlands, we support everyone, no matter their status, no matter if their language. We are here to support everyone and connect them to the best referrals here in our community. Our phone number is 402-733-2720. Again, 402-733-2720. Anybody can call. If they need support in Spanish, somebody will be there who can speak Spanish to refer them to the best individual in our team. Another way that people can get a hold of us is through social media. They can leave us a message or post a comment in one of our many posts. And then our Latino Center of the Midlands website also has a place where individuals can post their questions there as well. Although our office is physically closed, our phone lines are open Monday through Friday, 9 a.m. to 4 p.m. every day. Please leave a voicemail. If we don't answer, we will return your call as soon as possible. And if somebody needs direct assistance, they can also email me at valmanza@latinocenter.org. So yes, anybody can call us. Like I mentioned, we encourage everybody that has additional questions, especially regarding their documentation or status or immigration status here, to give us a call if they have any concerns or questions. We do not want to have anybody not get medical attention because they fear for their immigration status. So yeah.
Awesome. Well, thank you again so much, Viridiana, for hopping on and for being on the front line of this pandemic right here in Nebraska.
Yes, I do also want to say what we just saw was the Latino Center of the Midlands website, latinocenter.org. As you could see, there's immediate information. We have a hub of information in Spanish and in English. The Spanish information is obviously for anyone that speaks Spanish. And we have various categories from education to pantries, to other resources in our community. So please feel free to look at our website for any type of resource. We also want to encourage social distancing, mask campaigns. So we have a couple videos there as well, a video with Dr. de Alba, all information that will get us through this challenging times. And again, we need to do our part. We need to be aware. If you have any questions, please give us a call. We're here to support everyone in our community. Thank you.
All right, thank you. Well, lastly, I'd like to turn to Malka Sierra, who's a National Community Impact Consultant with the American Heart Association and a trusted voice for staff and volunteers within the organization. So we'd love to pick your brain a little bit. Malka, thanks again for joining us.
Yes, thank you.
Of course. So like I asked Dr. de Alba, we're several weeks into the COVID-19 pandemic. And the local health directives, how do you think that we're doing with dealing with this?
I think we're doing as good as we can under such a challenging circumstances. I think it's fair to say that no one was ready for anything like this. I think the way that we have responded is, while it's probably not optimal, I think the fact that the community has come together, I think the fact that, nonprofits like ours, Latino Center, have been able to, respond within, a couple of weeks to what, find out, first of all, what are those needs and then responding to meet those needs. I think it's great. I think the communities, again, we are such a resilient community, right? I think we just keep going. I know there's a lot of fear around, such a challenging situation, but the fact that so many of our communities still out there, going out to work and taking precautions best as they can, I think it's admirable. And I'd like to say that, again, we are doing as best as we can.
Now, with the American Heart Association specifically, how can you share a little bit about how they're responding to COVID-19 and how they're supporting the communities both locally and on a global scale?
So at a global scale, let me start by saying we've made within the first couple of weeks, we decided to make a $2.5 million investment in research to really find out more what is the relationship between cardiovascular disease and COVID. As Dr. Alba shared, what we're seeing is that those people with underlying conditions, are at a high risk. I think one of the statistics that I just saw, 40% of the patients that are, suffering from COVID have a heart condition. So it is, important for us to find out, specifically, so that we can better design treatments and have positive outcomes. In addition to that, we are also working with community organizations across the country, again, to be able to better coordinate the response. But also what we're seeing is a gap in communication, a gap of information. So this event itself. It's one of the ways that we're trying to fulfill that gap by bringing information specifically to our community, in many cases in Spanish if needed, in order to respond to that. In addition to that, we do have many online resources. We have now online programs that can help people stay active, which is one of the recommendations being made by health departments. Ways to, eat healthier, prepare healthier meals at home, and to ensure that you are addressing, any underlying conditions. So getting, just resources information out there has been one of our greatest response. And also working with, in many cases, with companies to make sure that they're safeguarding the health of their employees.
Yeah, a lot of work that we're seeing you guys are doing. Now, in recent days, there have been news articles on how the coronavirus is disproportionately affecting people of color in some communities. Can you share any comments on this and help us understand why this is happening?
So there are many reasons, I'm sure, as we know, disparities in health outcomes. It's one of those issues that we've seen. So we know that there is already that. I think this condition has exacerbated what we've seen for many years. We suspect that one of the main reasons why we do have a higher number of Latinos suffering from COVID-19, it's the fact that they're exposed more, right? So many of them are on the front line, working still. Second, many of them do have underlying conditions already. So again, like Dr. Alba explained, if you do suffer, for example, high blood pressure, you're already at a higher risk. And what makes it difficult is for you to be able to, to treat COVID a little different. So I think, just being aware of that. And then, third thing, as we know, is the fact that many in our community do lack access to care. So in many situations, just having access to a doctor, to have them to have access to a consultation could be difficult. So I would say those are the three main issues, but we won't know until all of this is done, because we still don't have the data to specifically know how this virus is really affecting the African American and Latino community specifically.
Sure, absolutely. And then, trying to again respect time. What are the 5 things people should know and do to stay healthy and to keep our community healthy? And, what is our role in all of this for each of our roles?
So I will probably repeat a lot of things you've already heard. Hopefully you've heard, and but those ones that I have proven to be effective. One of them is stay home if possible, whenever possible. If you can't stay home and you do have to venture out, make sure you're following proper precautions, right? And then again, follow the advice of your local health department or your doctor if you do have one. 2, like I said, the American Heart Association has recommendations around exercise and healthy eating. And also the other one that I think people are not as aware is how important it is for you to sleep adequately. So we've known that for those folks who are not getting proper rest, their immune system could be compromised. And then I think the last one, goes without saying, make sure you're washing your hands, that you're following proper physical distance recommendations.
Awesome. Well, thank you so much, Malka, for you and your team and what you're doing for all of the communities. It's so exciting to be working today with an organization that is truly of the community. So thank you.
Thank you.
Well, of course, we know that you guys are continuing to seek out and deploy innovative methods that allow us to bring value to our communities and continue to support quality and equitable health and wellness for all Americans. Now, very recently, I saw a quote that read, "Upstanding people have one thing in common, an absolute sense of mission." And I believe that is true of each of the panelists that we had on here today. Your commitment to the community and the overall mission of the American Heart Association drives impactful change in our communities. And we are so grateful for each one of you. And thank you for bringing answers and clarity to the community at this unprecedented and unsettling time. We have a few minutes left, so we're going to go ahead and move over to the panel discussion portion of our webinar. So during the discussion, I encourage viewers to leave their questions in the chat box. Now, we've been gathering questions in separation for this meeting, so we have some of those, and I've been going to try and see which one we haven't addressed, but one of them I think is important. So probably Dr. De Alba, you can probably answer this one. The next myth or confusing rhetoric that we hear these days is around medications to treat COVID-19. So are there currently any medications that can be used to support treating the coronavirus, or are there any medications that will prevent it?
Thank you for your question, Maya. It is very important that we have this clear message that we don't have to auto-medicate. Please do not take medicines that you hear that they work because they were shown to see an improvement in certain populations, and so, or a neighbor, classic in our communities. My neighbor told me that this medicine that was he takes for the cold or for previous cold works. Please don't do it. Because there are many things that we do not know about COVID-19, and we are learning how actually when you take a medication, it works, or interacts with the COVID-19. We don't know many answers yet, and there are many studies going on at this point that are trying to identify the medicine or the treatment or the vaccine for to treat COVID-19. At this point, there is no vaccine, there is no drug that has been proven that can kill or disappear or prevent the COVID-19. There are studies that are going on, and actually in our medical center, we have some research studies going on for identifying a vaccine, but those take months. And because there are many phases that we need to keep an eye on in order to say this medicine or this vaccine works. But it is not only about thinking if that vaccine or medicine kills, in this case, the virus. We also need to make sure that that medicine and vaccine do not harm us down the road, so that there are no secondary effects of that medicine when you take that medicine or when you have that vaccine administered, because that is part of the phases that we need to look at when we do research studies to identifying the best drug or the best vaccine. So at this point, there is no vaccine, there is no medicine for COVID-19. And there are some other preventive measures that you can do. Some people like to take some vitamins. If you don't have access to fruits and vegetables, those kind of like supplements with vitamins can work. There are some people who like, there are some traditions actually where we drink teas, that we know that it's safe and we regularly drink it. That is okay, because it's actually part of our culture to make us feel good and relaxed as well. Remember, mental health is very important, but that is different from the drugs or treatments that you obtain in the pharmacies, or things that can interact with your immune system that can have a negative impact and decrease or suppress your immune system. So we don't want that. And again, wait until there is an approval from the World Health Organization or from the CDC. Believe me, when there is a vaccine or a drug or a treatment, we all will know it, because this is an interest from everybody in the world, not only here.
Sure. Maybe one more question. So the next question came in about testing. What does the future of testing look like? We know that mostly only the sickest of the sick right now are being tested. Do you think communities will ever get to testing everyone?
Definitely in the ideal world, that's definitely something that we would love to see. Like everybody should, in this case, we would like to see more screening tests going around, especially those who work in the healthcare industry, those who are working in places where they have to be in close communication or contact with other members. This is on a personal note. Also, I do believe that the screenings need to be higher, and there are efforts going on already in the state and nationally. And that is important in order to know how we're going to start to modify the public policies that we have, because we need to know how many people are, in this case, with the virus or they have the virus, in order to have better or more accurate predictions. It is definitely something that we are working on, and there have been improvements about this specific topic.
Sure, absolutely. It's a good answer there. There's a lot of other questions that we had there, but unfortunately we're running short on time. I'm sure that we'll be able to post some of the questions and answers somewhere after this, so we'll be able to share that. But thank you again to all our panelists for joining us today. Now, like I have shared throughout, we would like to extend our deepest and most heartfelt thanks to those individuals and organizations who are fighting on the front lines to save lives during this pandemic. We know that together we can preserve, protect, and continue to build a healthier community right here and across the state. Now, in this new reality, there will be unquestionably new challenges for all of us as we press forward to achieve our mission. And we look forward to continue to collaborate with each of you to extend people's lives today and in the future. To that end, there are ways you can stay engaged with the American Heart Association, achieving their mission of extending lives. You can connect with them online at www.heart.org/COVID-19. And there you can have live chats, you can get support from patients and caregivers, and information on how to stay healthy. They have all that information right there, and you can see that on your screen right now. You can also stay up to date with local activities on their social media channels. They have everything on all their platforms, just at Heart Nebraska, Instagram, Twitter, Facebook, they have it all. You can stay healthy. You can find resources there on managing stress, which is also important during this time. There's nothing normal about this. Eating healthy and being physically active, you can find that again on heart.org. And we have a great opportunity to celebrate health. You can join a sidewalk or street near you for their first ever virtual heart walk. And to register, you can visit the American Heart Association Nebraska social media pages. My station, KMTV, is a proud sponsor of the event, so definitely will be participating in that. And to close, we have 3 quick questions for our audience. So the poll will appear on your screen now, and we would like you to please rate your response between 1 and 5. And 1 being disagree and 5 being I agree. So the first one is, I am aware of at least 3 strategies to support health and well-being regarding social distancing and state health directives. So we'll give you a few minutes, or a few seconds actually, because we're, again, trying to be very respectful on time. So if you can answer that one. The second one's going to be, I know what heart disease and stroke patient survivors should do to protect themselves amidst the COVID-19 pandemic. So yeah, you can answer all 3 questions on there. The third one is, I understand the American Heart Association's response to COVID-19. So we can go ahead and answer those again, 1 being disagree and 5 being agree. Well, again, it is 1 o'clock, so we promised we'd keep it to 1 hour, so we try to do our best with that. Thank you again for joining us today. Thank you to our panelists for a dynamic conversation, a lot of good information there. And thank you to all of you, our attendees, for your attention and engagement. We'll have a link to this full community conversation available on the American Heart Association social media pages. They'll also be doing follow-up with registered attendees with the recording, as well as links to resources that can support your efforts to flatten the curve. Well, this concludes our COVID-19 community conversation. Until next time, stay safe, stay healthy, stay connected, and if possible, stay home. Thank you.